Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr. Dawn Harper and today I'm talking about deep vein thromboses. A deep vein thrombosis, or DVT as it is often called, is a blood clot in the lower leg. It usually affects one leg and it can lead to a swelling in the calf, which is often hot and red to touch and may be really very painful, particularly in the back, in the belly of the calf. Also, if you move your foot and lift your toes up towards the front of your shin, that may make the pain worse. It's a sign that we look for as doctors when we're examining and ruling out or trying to make the possible diagnosis of a DVT. Travelling can dispose you to a DVT because you're sedentary for a long period of time. So we do recommend that when you're travelling, whether it be in a plane or a train or a ferry, that you get up and walk about if you can every hour or so. If you can't do that, then simply draw circles with your toes in the air to get that blood pumping around and stop it from sludging in the veins. Certain people are more prone to a DVT than others, and that'll be people who are overweight, people who have a family history of blood clots, so definitely worth checking with your family whether people have had blood clots in the past. Also people with heart disease and those with cancer, as cancer can make your blood more sticky. It's also more common in people who've had recent surgery and perhaps been inactive for a while whilst they recuperate. And it can be related to certain drugs. Classically, things like the combined contraceptive pill or HRT may predispose you to a DVT. Now, really important that you don't stop taking any prescribed medication without speaking to your doctor. But it is worth contacting them and having a conversation if you're planning certainly a long haul travel as to whether or not you should take a small break from that medication. And whilst you're having that conversation, speak to your doctor as well about junior aspirin. Now, junior aspirin does thin the blood, just a 75 milligram dose will thin the blood, and that may be appropriate, but we have to remember that aspirin also has serious side effects and it can increase your risks of a stomach ulcer or bleeding from the gut. So really important that you have that conversation with your doctor to check whether or not it's appropriate for you to take. The other things you can do though is you could think about compression stockings, which help to squeeze the veins in the lower leg and keep that blood returning back to the heart and on the move. So those are things that you could consider. And I would also recommend that you stay well hydrated. If you become very dehydrated and on a long haul flight, for example, that is quite a possibility, then the blood gets thicker and you're more likely to have a blood clot. So with that in mind, beware alcohol. So alcohol, of course, is a fluid, but it's also a diuretic, and it can mean that actually you're weeing out more fluid in total than you're taking in, leading to dehydration and possibly increasing that risk. So I hope that you all have a lovely holiday. I hope none of you come back with a DVT, but do remember those signs to look out for. If you come back from a holiday and you notice that your leg is swollen, hot, red, and tender, then absolutely you must get that checked out by your doctor. A blood clot in the leg is unpleasant and painful and requires treatment, but if part of that clot flies off into the lungs and causes what we call a pulmonary embolus, so a PE, that can be fatal. So these are symptoms you absolutely mustn't ignore. Apart from that, I hope you have a lovely holiday, and as always, please remember, if there are things that you'd like me to talk about on this channel, either message me here or send us an email anonymously from the website. We'd love to hear from you and make this resource as useful as we possibly can for you. But until then, take care.